Pathogenesis of Ancylostoma caninum infection or Ancylostomiasis. First, I would like to highlight what happens when a patient or a dog infected via percutaneous peroral route of infection. So you know the adult parasite ingests mucosal layer. This is also known as plaque feeder, and this parasite is also a voracious blood sucker. They will suck, that is, a parasite can suck 0.01 to 0.09 ml per day. So what happens when there is plaque feeding as well as blood sucking continues? So there will be the hemorrhage. So hemorrhage normally starts after 8 days post infection, and one of the interesting thing, this parasite releases Ancylostoma caninum anticoagulant protein XA. The function of this factor is to prevent blood coagulation. As a result, there will be continuous leakage of blood from the intestine, and there will be generalized hyperproteinemia. Due to the continuous leakage of the blood from the intestine as well as due to the blood sucking activities of the adult parasite, there will be anemia in adult as well as puppies. If there is anemia in adults or older puppies, it can be compensated by increasing erythropoiesis. So less severity of the anemia can be seen. But if it is occurred in newborn puppies, there will be less compensation as the bone marrows are underdeveloped. As a result, there will be severe anemia can be seen. And normally, they are normocytic, normochromic anemia, but later on, macrocytic and hyperchromic anemia are seen. In this case, animal may die within 10 to 20 days post-infection. 10 to 20 days post-infection. And another thing can be happened due to the losses of intestinal mucosa followed by damage of the intestinal mucosa. There will be this damage will act as the route of entry for other bacteria. As a result, there will be inflammation and contributed to the diarrhea after four days post-infection. And the feces color would be tarry color, and there will be presence of some watery mucus. So in this picture you can see the immature hookworms on the mucosal layer, and here you can see the damage caused by the parasite. So in case of percutaneous route of infection by the infective stage L3, that is skin penetration by the larvae of the L3, and this will result moist eczema to ulceration, especially on the affected feet or interdigital spaces. And the clinical sign will include foot stamping and as well as itching of the affected sites, and this may contribute to the lameness of the animal. And due to the skin penetration by the larvae, there will be a wound in the affected site, and due to the continuous irritation, there will be leaking and biting of the affected site, which also contributed to the secondary bacterial infection. As a result, moist eczema to ulcerated lesion will be found. And if the L3 will reach to the lungs, there will be hemorrhagic pneumonitis, and in severe cases, there is consolidation of the lung due to the granulomatous inflammation. And just for your information, severity of the infection depends on intensity of the infection, age of the host, nutritional status, iron reserve, and the overall immune status of the host.